Get ready to feel like you've stepped into an operating room, without the whole surgical gown thing. Because today, we're diving deep, deep into the cutting edge of surgery.
Yeah, the stuff that's happening in surgery these days is pretty mind-blowing. Like, what seemed impossible just a few years ago is becoming pretty routine.
Seriously. It's amazing. To guide us through all of this, we're taking inspiration from a recent Precision Scalpel podcast episode. It's all about the latest, groundbreaking stuff in surgery.
Yeah, precision scalpel is great.
And don't worry if you don't have a medical degree.
Right.
We'll break it all down, make it super clear and fascinating, light bulb moments for everyone.
What I think is so cool is that these advancements aren't stuck in some research lab. They're actually making a real difference in people's lives. Like, patients are recovering faster with less pain and seeing results that were unimaginable a while back.
Okay, imagine this. You're prepped for surgery, and you hear the surgeons using a robot.
I bet some people would freak out.
I'd be like, hold on, what now?
It's totally understandable. But robotic surgery, especially with systems like the Da Vinci, is becoming more and more common. Imagine this. The surgeon is at a console, kind of like a super high-tech video game setup, controlling these crazy precise robotic arms, and these arms have tiny instruments. It allows for a level of dexterity and control that traditional open surgery just can't match.
So wait, so instead of the surgeon's hands, you have these robotic arms doing the work. That's wild.
Pretty much, yeah. And the cool thing is they're super nimble, almost like having tiny wrists, for maneuvering in tight spots.
That's mind-blowing. But it's got to be more than just being cool tech, right?
Yeah.
How does this help patients?
Well, because the cuts are way smaller and the movements are super precise, there's less damage to the surrounding tissue. It's like, imagine you need to make a small cut, and you have a choice between a tiny scalpel and a butter knife.
Uh-huh. Okay, I get it. The scalpel is the obvious choice for a cleaner, less messy cut. So less trauma means less pain, less scarring, faster recovery. That's huge. You're back to doing the things you love way quicker. And to make sure robotic surgery is as precise as possible, there's another technology that's playing a huge part. 3D printing.
Oh, definitely. 3D printing has gone from, making models to being a vital tool in surgery. Now, surgeons can use it to create an exact model of your anatomy based on your CT and MRI scans.
Wait, seriously. So they take your scans and create a 3D model, of your bones, your organs, everything.
Exactly, like having a life-sized replica of your own body. These models are changing how surgeons plan, especially for really complex cases.
It's like being able to rehearse the surgery beforehand, anticipate any problems, and plan their moves with incredible accuracy.
You got it. It's all about minimizing surprises and ensuring the absolute best outcome for the patient. Now, remember how you used to have to, starve yourself before surgery?
Ugh, yeah, nothing to eat or drink after midnight the night before. The worst.
Well, those days are fading fast thanks to something called Enhanced Recovery After Surgery Protocols, or, for short, ERAS.
ERS. That sounds like a whole different way of thinking about surgery.
Yeah, it's not just about the operation itself, but also about helping your body recover as quickly and smoothly as possible.
I'm all ears. Tell me more.
It's about reducing your body's stress response to surgery. So instead of making you fast for hours, they're actually encouraging patients to have a carb-rich drink a few hours before.
Wait, really? I would have thought an empty stomach was always better.
You'd think so, right? But studies show that keeping some nutrition in your system actually keeps your blood sugar stable and helps with insulin, which can really help you heal faster and with fewer problems.
Huh, who knew? So it's less about an empty stomach and more about giving your body the energy it needs to recover.
Yeah.
What else is involved in this whole ERS thing?
Well, pain management is a big one. ERS often uses a bunch of different methods for pain relief, meaning they're not just relying on strong painkillers after surgery, which we know can have nasty side effects. They're getting much better at managing pain more effectively.
Makes sense. Finding ways to target that pain without bombarding your system with a ton of meds.
Exactly. And maybe most importantly, ERAS is all about getting patients moving sooner.
So no more lying in bed for days after surgery.
Not if they can help it. Getting moving, even if it's just sitting up or taking a few steps, is so important for preventing things like blood clots and pneumonia. It helps with circulation, lung function. It really does make a huge difference. Yeah, it's really important to get moving. Helps you heal so much faster.
Right. Makes total sense.
Yeah.
But I got to ask about AI. Everyone's talking about it. It's got to be a part of this whole cutting-edge surgery thing, right?
Totally. But before you go picturing, A robot surgeon in a little tiny mask, it's not quite there yet.
Okay, good to know.
But it's already doing amazing stuff, especially when it comes to analyzing those medical images.
You mean those detailed CT scans and MRIs?
Exactly. AI algorithms can analyze those images incredibly fast, like crazy fast, and accurately, often picking up on things even the most experienced doctor might miss.
It's like having a second set of eyes,
Yeah.
but these eyes are, like, super powered.
Yeah, and they never get tired. What's really cool is that AI can spot those subtle changes, like in tissue density or blood flow. It could be a sign of a tumor, maybe something else abnormal, things we might not catch right away,
AI is your co-pilot.
basically. It's like having a supercomputer double-checking everything, making sure we don't miss a thing.
That's awesome. So we've talked about robots and AI. What about COVID? They talked about managing surgical patients with COVID on the podcast too, right? That throws a whole other wrench into things, doesn't it?
Yeah, definitely. The pandemic really changed the game for everyone, including surgeons. Now they have to consider a patient's vaccination status, if there's any risk of breathing problems, and how to keep the whole surgical team safe. It's a lot.
Talk about pressure. It really shows how important it is to have, like, really solid guidelines and protocols in place to keep everyone safe, the patients and the healthcare workers. And speaking of safety, we got to talk about infection, right? That's always a concern with surgery.
Absolutely. Surgical site infections are a constant worry, and surgeons work really hard to prevent them. We talked about ERS and how it helps reduce the risk of infection, but there's another thing. It's called a surgical checklist.
Oh, yeah. They mentioned that on Precision Scalpel, right?
Yeah.
Like a pilot going through a pre-flight check.
Exactly. It's so simple, but it's been a game changer for patient safety.
How does it work?
It's a set of steps that the entire surgical team goes through before, during, and even after every single surgery.
Like a team huddle before hitting the field, make sure everyone is on the same page.
Yeah. They confirm who the patient is, the exact procedure, any allergies, medications, even making sure all the equipment is there. It's all about minimizing mistakes and making the operating room as safe as possible. But it doesn't stop there. Recovery plays a big role, too. Speaking of recovery, Precision Scalpel also got into nutrition. They said it's really important for healing.
Food. I never really thought about that.
Yeah, most people don't. But what you eat or don't eat really affects how well you recover from surgery. Think of it like building a house.
You need the right materials for a strong foundation.
Exactly. Your body needs the right nutrients to rebuild tissue, fight off infection, and get your strength back. That's why a lot of hospitals now have dietitians who work with patients to make sure they're getting the right foods before and after surgery.
Wow, that's impressive. Taking a holistic approach, not just focusing on the surgery itself. Okay, so we've covered some high-tech stuff. What about the actual surgical techniques? Precision Scalpel mentioned something called sentinel lymph node biopsy, or SLNB. What is that?
It's a big deal, especially for cancers like breast cancer and melanoma.
But back up for a sec. What even is a lymph node? Why is it important when it comes to cancer?
Okay, so picture lymph nodes like tiny little filters all over your body. They're part of your immune system, and they trap harmful stuff, like bacteria, viruses, and unfortunately, cancer cells.
So they're like little guards trying to protect the rest of the body.
Exactly. Now, in the past, if you had a tumor removed, they'd also take out a bunch of lymph nodes nearby, just in case. But that could cause problems like lymphedema, which is basically painful swelling.
So SLNB is a less intense way to get the same information.
Yeah, basically. Instead of removing a bunch of lymph nodes, they pinpoint the sentinel lymph node. That's the first lymph node cancer cells are likely to spread to.
Like it's patient zero for the cancer's potential spread.
You got it. If that one is clear, chances are good the others are too.
Smart. So less invasive, less risk.
Exactly. It's all about minimizing those risks. And speaking of less invasive, the podcast also talked about bariatric surgery, for weight loss.
Oh yeah, gastric bypass and things like that. They've become so much more common.
For sure. And it's understandable. Obesity rates are going up, and for some people, bariatric surgery is a life changer, but it's a big decision.
It's definitely not a quick fix.
Nope, not at all. It's major surgery, and it requires real commitment from the patient before and after. It means making big lifestyle changes, like eating healthier and exercising regularly. Surgery is just one part of it.
So it's really important to go into it with realistic expectations, knowing it's a journey and not a magic solution. It really makes you realize surgery is a big deal, and it's not just about the physical stuff. It's a whole mental and emotional thing, too.
You got it. It takes a lot of strength and support to get through it.
Speaking of intense, precision scalpel also got into some really intense situations, like massive gastrointestinal bleeding. That sounds terrifying.
It can be really scary because you have to act fast. But as I talked about on the podcast, even when it's high pressure, you got to have a system. Stabilize the patient first, figure out where the bleeding's coming from, then figure out the best way to treat it. Could be something like endoscopic therapy, or it might even mean surgery.
So it's like a race against the clock, but you've got a plan and a whole team of experts ready to jump in. That's reassuring.
Absolutely. You have to be prepared.
Okay, ready for something totally sci-fi? Augmented reality, AR, in surgery.
I know, right? Sounds crazy.
I've seen it used for games and stuff, but surgery, that's next level.
It's amazing how AR is changing everything. Imagine the surgeon can actually see a 3D model of the patient's insides, like right on top of their body during the operation. It's like X-ray vision, but better.
Wow. What are the advantages of that?
It gives surgeons real-time guidance, makes them even more precise, and helps them plan out those super intricate surgeries.
Like having a super high-tech GPS for the human body.
Mm-hmm.
So we've covered so much ground today, from robots to AI, minimally invasive techniques. It's clear that technology is totally changing the game when it comes to surgery. What are your thoughts on all this?
It's incredibly exciting, and honestly, we're just scratching the surface. New tech, new techniques, it's all developing so fast. It's really amazing to see.
It feels like a whole new world of possibilities, but like we've been talking about, it's not just about fancy machines. It's about the surgeons, the whole surgical team, their expertise, and how they use these tools to heal people. That human element is so essential.
Totally agree. Technology is amazing, but it's the people who make it all work.
Absolutely. Well, it looks like we've reached the end of our surgical adventure for today. We've covered a lot, from those robotic arms to artificial intelligence, and even the importance of things like good nutrition and having a solid plan for recovery.
It's been awesome exploring all of this with you.
We hope you've enjoyed this deep dive into the world of cutting-edge surgery. Now, we want to hear from you. What recent medical breakthrough has you totally fascinated? Let us know. And until next time, keep those brains buzzing, and we'll catch you on the next deep dive.